Hello friends, I am Dr. Sutar from Sanjeevani College of Pharmaceutical Education and Research. Friends, today we are going to study a subject that is a herbal drug technology. In this one chapter, we are going to see the traditional system of medicine. So friends, traditional system of medicine is what? The system of medicine which consists of the variety of the treatment which are to be comes from the ancient period of the time. Just like that in our India, variety of the peoples are there, peoples from the different religions are there. They come from the different countries to live in India. Okay, so along with them, they are bring their system of the medicines. So in mostly already in India, the Ayurveda is there. That issue there. So that system is to be considered as a traditional system of medicine. Traditional system of medicine means from the ancient period of the time, the system of medicine which is to be utilized to cure the different type of the diseases, to treatment, diagnosis, prevention, likewise the things are there. So these are the Rishi Munis are there, they are going to train their some of the Shishyas to collect the medicine from that one particular plant materials are there, some of the animals are there, minerals are there. Likewise, in earlier, the whole plant of the medicine is there should be utilized, but later on, the plant is there that should be isolated part of the plant is there is to be utilized. Okay. So then the different methods of the extractions are there that are to be studied. Then by utilizing the column chromatography, the system of the medicine is there should be modified. The isolated components are there that are to be utilized. Then from this one isolated component, the different medicines are there that are to be utilized. Likewise, the modification is there is to be going on. So, in ancient period of the time, the drugs are there that is to be utilized either the whole plant, just like the tulsi, the whole plant is there should be utilized. Vinca, whole plant is there should be utilized. Somewhere the isolated parts are there that are to be utilized, such as the cinchona bark portion is utilized. Eucalyptus leaves are there that are to be utilized. Rauwolfia roots are utilized. Nux vomica seeds are utilized. Ipecacuanha roots are utilized. Papain the fruits are there that are to be utilized. Likewise, the different parts are there that are to be utilized in the preparation of the drug material. Somewhere the oils are there that are to be utilized, or the extracts, infusions are there that are to be prepared, and then they are to be utilized in the different type of the form. So, Ayurveda, the system of medicine, it consists of the variety of the treatments are there that are to be utilized in case of that one. So some of the medicaments are there that are having a benefit, so they have to be required daily. So now it becomes a habit to use that one medicines daily. So in a diet, that medicines are there that are to be added. Some of the organized or unorganized part of the plants are there that are to be utilized, such as the licorice is there, ginger is there, cardamom, caraway is there, fennel is there. They are required daily. Clove is there, turmeric is there. Okay, they have beneficial effects on the body. They keeps the human being to from the attack of the different type of the diseases. Some of the medicaments are helpful to improve the immunity power is there, such as the gulwell is there. Then your vasaka leaves are there. Okay, your ginger is there. So they'll help to protect the occurrence of the disease into the human being, such as, so they are to be utilized for the prevention of the disease. So Ayush is the department is there. Ayush is the ministry of the department is there. So that is to be helpful. That cover the variety of the treatments are there in case of this one. Okay. So what do you mean by Ayush? A stands for Ayurveda. So these are the system of the medicines are there that we utilize in case of the different type of the treatments are there. Okay. So the system of the medicine that covers Ayurveda is the most one is there. Okay, so these are the different type of the medicines are there. Now, in case of the Ayurveda, they have to be started from your dental products. The our day is there should be started with the Ayurveda. Everywhere the Ayurveda is there should be take care regarding the hygienes of the human being, such as the dental care, skin care, your hair cares are there. Everywhere the herbal products are there that are to becomes here. So A stands for Ayurveda. The second one is that is a why. Why is nothing but the yoga exercise that also plays an important role to have a healthy life. Y stands for yoga. U stands for Unani system of medicine is there where they are to be give an importance to the four humors is there on which the treatment of the Unani system is there is to be based. Then Siddha, S stands for Siddha system of the medicine. Here these are our five central points are there where the stimulation of these one particular points are there that enhances the immune power as well as the concentration is there that is enhanced. So Siddha system of the medicines also plays an important role. Then H stands for homeopathy system of medicine. So where the pills are there, white color pills are there that are to be utilized in the preparation of that one medicines. In this system of the medicine, it consists of uprooting of a thorn by utilizing another thorn. So the disease causing agent is the disease is there should be removed by the same disease causing agent which is to be ingested into the human body as well as the animal body in a very dilute form. So likewise the treatments are there that is a Ayush is the one. So now let's we see that introduction. The Indian system of medicine is there is accumulation of the different variety of the medicines are there where the peoples from the different countries are there that are to become along with them they are carry their system of the medicines. So the main purpose of this system of the medicine is there to have a healthy life for a long period of the time. So the main purpose is there just like that. Unani system of the medicine is the foreign one, which is to be came from the Greece. Homeopathy system of the medicine is to become from the Germany, whereas the other systems are there that are to become, but the Ayurveda is the one which is to be of the Indian system of medicine. Ayurveda, Siddha, as also the yoga and naturopathy, they plays an important role in case of the life of the human being to maintain the healthy life of the human being. So the multidimensional cultures are there in case of the India. So traditional system of medicine developed over centuries based with the excess of the traditional medicines and their practices. So Ayurveda, that is the 5,000 years back, the Vedas are there, they are to be documented in that one. What are the different system of the medicines are there that are to be there, that is to be documented. Sushruta is the one who is the main important is there in case of the Ayurvedic system of the medicine. This Ayurveda is a classical system of the healthcare means for the variety of the purposes the Ayurveda plays an important role and that is documented last 5,000 years back. Around the 1,000 years back, the knowledge of the Ayurveda was first comprehensively documented in the Kampondiya. It's called Charaka Samhita and Shushruta Samhita. Means what is the knowledge is there which should be documented over 5,000 years back. Later on, this knowledge is there, it should be documented in the Kampondiya of Indian medicinal plants are there, such as your Charaka Samhita is there, Shushruta Samhita is there. So in this case, the information is there should be documented. So what is there in case of the Charaka Samhita? Charaka Samhita that gives an information regarding the cause of the disease and cure of disease. Why the disease is there should occur? What are the precautions we have to take to cure from that one particular disease? Second one is their introduction of the objective methods of the clinical examination. How you came to know that you are suffered by that one disease. So some of the parameters are there. Depends on parameter, you can say that you are suffered by such type of the disease. For example, if there's a yellowish tinge is there in your eye, is there, then your nails are also somewhat having that yellowish color. You can by these ones symptoms or parameters we can say that you suffer by jaundice. Second one is the fundamental basis of the Ayurveda. Our body is to be made up of the five basic elements as per the Ayurveda. So these five basic elements are nothing but your Panchamahabhuta is there. So that includes Prithvi, Agni, Jala, Akasha, Vayu. Likewise, these are the five basic elements are there, and they are to be maintained in our body in a proper proportion. So, if there is an imbalance in case of this one, that results in the developing a disease condition. So, there is a three humerals are there that we call as a Tridosha, such as your Vata, Pitta, and Kapha. So these are the three humerals as per the Ayurveda is there. Vata, it consists of the ether as well as air is there. Second one, Pitta, it consists of the fire as well as water. Kapha is there, earth, ether and earth and water is there. If they are balanced so that there is a no occurrence of the Vata, Pitta as well as Kapha. If any one of the element is get disturbed, that leads to the development of that one particular disease. If there is an increase or the low concentration of the ether or air in our body, we are going to be suffer by vata. If fire is more or water is less or vice versa, we are going to be suffer by pitta. And ether, earth, as well as the water is there, where if they are get balanced, we are suffer by the kapha. So whenever there is a disease is there in your body, so any one of the element is there is to get disturbed, because of which you may suffer by vata, pitta or kapha. So when you go to the physician diagnose you depends on the parameters, and they observe you which parameter is going to be disturbed, such as your whether air, water, earth, fire, is there any one of the element is there is get disturbed, and because of which you are getting to be disturbed. So you are suffer by that one particular disease condition is there. So in this one treatment they are going to give you a search statement where this one Panchamahabhuta is get balanced. Once the Panchamahabhuta is get balanced, you are three humoral because of which you are get disturbed, such as Vata, Pitta, Kapha, you are get covered from that one disease condition. So these physiological entities in the living, they are responsible for the metabolic functions and that leads to the development of the disease if they get disturbed. There is also another one, mental characters are there. Human beings are the characteristics of the three mental characters are there, such as the sattva, rajasa and tamasa. These are the behaviors are there. Okay, means how the behavior of the patient is there. So someone is there that is a sattva, someone is a rajasa, someone is a tamasa. That we called it as a triguna. So friends, Ayurveda is mostly keep the human structural organs as well as the function in the state of equilibrium. Means what is the body of the, as per the Ayurveda, human being's body is the proper one, functioning of the organ is a proper one, and they are not require any type of support to perform a normal function. So that is known as a swasthya. Means what the organs are there that are performing their functions without any independency. So they are to be known as a swasthya. Okay. So any imbalance in the internal as well as the external factors that leads to the disease condition, and the treatment it consists of the restoring of the equilibrium through the various procedures such as the regimen, diet, medicine, and behavior changes. These are the four components are there on which the Ayurveda system of the medicine is based. The preventive features of Ayurveda is known as a Swastha Vihar. It includes personal hygiene, then daily as well as the seasonal schedule. What is your daily schedule is there, and what is as per the season, the schedule is there should be prescribed by Ayurveda, and the appropriate behavioral and the use of the material practices. All these combinedly that leads to the removal of the disease condition from your body. So friends, so Ayurveda that help you to do or not to do, does or don't does. Okay. So the curative treatment it covers your ahar, vihar, and aushadhi. First one is there that is a ahar is there. How much time you are going to take your diet, what type of the food you are going to be consumed, what is the timing is there, so that is the lifestyle that also involves vihar, that is your lifestyle means when at what time you are going for the sleep, when you are going to be wake up, are you going to perform the exercise or not? What is your diet schedule? What is your diet contains? Likewise, the different parameters are there that are to be take into the consideration. And as per if your there is a lacking of this one, any one of them, then the suggestions are there that are to be given and asked to perform such type of the activity. And along with them, the aushadhi, we call it as a drugs are to be prescribed. Okay. Ayurveda largely uses the plant sources, materials, raw material, then manufacture the drug through the different type of the sources such as the plant source, animal source, marine source, microorganisms are there that is also to be utilized in case of the preparation of that one particular drug. So minerals are also utilized. Some of the metals are there that are to be utilized. Means minerals as well as the metal they are to be converted into the bhasma form and then they are utilized. Ayurvedic medicines are generally the safe one. If you are going to be take that one particular medicine in a prescribed dose, in a prescribed manner, then and then they are to be safe one, else they are dangerous also. The curative treatment is consists of your ahar, vihar, aushadhi. Okay, then they are utilized the some of the plant materials are there. Okay, Ayurveda is proved to be the effective in the treatment of the some of the chronic diseases are there which is not to be covered by any type of the system of the medicine. Then Ayurveda plays an important role in case of the removing that one particular disease, or we can say that curation of that one disease from the human being or the animal being. Okay, there is another one. Over the year, Shara Sutra and Panchakarma treatment is there should be given. So, what is the dirt or the toxins which are to be deposited in your body, it is necessary to remove that one particular toxins through your body. So there is a panchakarma treatment is there should be given. That panchakarma treatment includes elimination of the radical which leads to the disease throughout your body and to maintain equilibrium of the humor. So five detoxification process are there that is known as a panchakarma treatment. First one is there that is a Vamana. So what are the poisons or the toxins which are to be deposited in your stomach? They are to be removed by the medication. Emesis is that should be induced that is known as a Vamana. Second one is virechen, that is a purgation. So the empty of the GIT is that we carried out just by the virechen is there. Then Basti, some of the medicaments are there that is to be given by the rectal route of the administration that is to be known as enema. Nasya, mostly the person who are to be suffer by the migraine, headache, and then your sneezing, coughing. In that case, Nasya treatment is there should be given. So these are the four, and last one is there, that is Rakta motion is there, blood letting treatment is there. So what is the toxic blood which is to be accumulated at the particular area, so the incisions are there that we make on that one particular area, and allow that one particular blood to get removed from that one particular affected area. Once the blood is removed, immediately you get the relief from that one particular disease condition. So Panchakarma treatment minimizes the reoccurrence of the disease and promote the positive health by regenerating the body tissue and biopurification process. So friends, as per the Ayurveda, there is a one Shara Sutra is also one, that is a parasurgical intervention is there, that is utilizing a alkaline thread is there for the cauterization. That is the to burn one part for closing another one part. Just like there is a mole is there. So in case of the mole, there is a surgery treatment is there should be given. So if you want to remove that one mole, there is a fine thread which is we make alkaline, that is we tie tightly, because of which the blood supply to that one particular area is get reduced, and ultimately that one particular part we can say that mole that is will fall down. So this is the one Shara Sutra treatment is there. So likewise the variety of the treatments are there that is we utilize. What are the chronic diseases are there, that is also to be covered by the Ayurveda, that is known as a polyp, wart, non-healing chronic ulcers, sinusitis, as well as the papillae. Such type of the diseases are there that is cured by Ayurveda. So friends, here we have studied Ayurveda system of the medicine. So in the next one, we see that the Unani system of medicine. Okay, thank you.